everyone, welcome back. And if you haven't subscribed, please do. So today we are going to talk about another 3 important symptoms of sickle cell that you should consider as emergency. Okay, so we are going to look at number 1, painful prolonged erection. Number 2, a persistent fever or a high temperature. And number 3, sudden deterioration in your vision. Okay, so I'm going to look at the causes, okay, some of the underlying causes of this in a person with sickle cell, and also some of the things that you can do to prevent this from happening, and also why this is considered as emergency in sickle cell. So thank you for joining me, and do enjoy this video. Okay, so priapism is a long-lasting painful erection. Okay, now this is a complication caused by sickle cell because of the blocked blood vessels in your penis. So the blood goes in, but it's unable to flow out, causing a painful, prolonged, long-lasting erection. Okay, now priapism normally gets better on its own after 2 hours. So if it lasts between 30 minutes and 2 hours at home, there are certain things that you can do to relieve the pain, and I will give you some examples of things you can do at home. But if this painful erection lasts for more than 4 hours, you need to seek medical attention ASAP. So if it's more than 4 hours, it is a medical emergency. And guys, you'll be very surprised that we see this in children as young as 5 years old. So if you have a young boy with sickle cell, this is important to bear in mind. So the common presentation that we see in hospital is between ages 5 to 35. So this is very important that you remember that this can happen to you as a young man, and if not treated, it can lead to permanent damage of your penis. Okay, so it's important that you as a sickle cell sufferer have your eye examination every year. Okay, now you can have this done by a normal ophthalmologist in the community, but it's important that you ask this person to have a good look at the back of your eye, because the sickle cells can damage the blood vessels at the back of your eye. Okay, now when we see people in clinic, we always ask them, how is your eye okay? For the children, we ask, can you see the board properly in your classroom? Okay, and some of the symptoms that a child can give is they see floaters. So as soon as they say they can see things floating in their vision, then we refer them to hospital for a proper intensive eye check, because this is an emergency, as the blood vessels at the back of the eye can burst and cause permanent damage. So again, this is sickle cells blocking the blood vessels in the eye. So early treatment is recommended, and sometimes we use laser therapy, because that can help with this eye problem. Okay, so it's very important that you ask your ophthalmologist to have a good look at the back of your eye. Okay, so I would just like to say a big thank you for sticking with me this far, and I hope you enjoy learning about your condition if you're a sickle cell sufferer, or if you're a student or a student nurse. I hope you enjoy learning about sickle cell, and I hope this will help you to give better care to your patients, and to help you to better understand the condition. Okay, so here we have fever. So fever is an emergency because we say that it might be a sign that it might be the first sign of a serious infection. Okay, so if a child or a person with sickle cell has a fever for more than 2 days, and if that temperature is over 38 degrees, then you need to seek medical attention as soon as possible. Okay, so if the fever at home, if the child is having fever at home, and we know that children's immune system is not very mature, so we know that they're prone to infections and they're prone to having high temperatures. So you can try and treat that at home for, say, the first 24 hours with paracetamol, Calpol, and ibuprofen. Also, for children with sickle cell, we say that you can increase the penicillin to 4 times a day, because 4 times a day penicillin is what is recommended anyway for children who have an infection. But with sickle cell, because they are on penicillin permanently, we only use it twice a day as routine. But it can be increased to 4 times a day while you're waiting for advice from your GP. So call your GP for advice. Also, if the fever lasts for more than 2 days, you need to take your child into hospital, or you need to take yourself into hospital as a sickle cell sufferer, because in hospital they will try and do some investigations to find out the underlying cause of the fever, and they will put you on stronger antibiotics, which may be in the form of intravenously, like IV antibiotics. Okay, but it's very important that you have this prolonged temperature investigated. So this is an emergency because we do not want this to turn into something more serious. Thank you and goodbye.